Health officials can't rule out the possibility of community transmission in 2 confirmed coronavirus cases. Unlike the other cases, these 2 cases can't immediately be linked to overseas travel, but their contacts are still being traced. It's significant because if there is a case of community spread where the source of the infection cannot be identified, it could lead to more stringent rules around social contact, work and travel, and could trigger school closures. One of the cases needing further investigation is in Auckland. The other case is a Carterton District Council staff member who has been confirmed with the virus. Greg Lang is the Carterton Mayor, and a few minutes ago he told me the staff member in question hasn't been at work for about a week.
But that staff member did everything right. He self-isolated as soon as he got the symptoms, which included not coming to work. We're very confident of the proactive measures that we've got in place.
Is it because you're such a smallish community you felt that it would get out and around anyway?
It's just a responsibility. It's an expectation we have from our community. You know, we're very in touch with our community, and there was no other. As far as we saw it from a governance point of view and management point of view, there was no other option.
So you say he. So was this staff member? Is he front of house? Would he have had contact with members of the public?
The person worked quite remotely, and there was only a small crew around him. So as soon as those people were identified, they've been self-isolated as well. And they've been tested.
How many other people from the council has this person had contact with who are now having to isolate themselves?
It's only a very small number, and the Ministry of Health is working with them at the moment.
So, to the best of your knowledge, had this person been travelling?
I don't know, and that's really what the Ministry of Health is trying to work out. Really, that's just not our area of expertise. Our area is to inform our community and do the best practices we can to ensure that our community is safe.
So, in terms of other council workers, how many would you think it affects? Less than a dozen? More?
Much less than that, really. As I said, this person worked very remotely, and we've been in touch with the Ministry of Health, and they've advised us that all the steps that we need to take, and about basically assessing if there's any risk, and we just want to ensure the community that we're following their guidelines.
So, does this mean anything is going to change with council services?
Not at this stage, but we're watching the space very, very closely. We've got a pandemic plan which we instigated right at the start of Covid-19, and we've constantly been reviewing that, and we've had continuity planning well underway. So, example, our essential services, the people that maintain them, like water supply, have been self-isolated and always work remotely. So we're well advanced that, and again, that's an expectation the community has.
So you're basically ring-fencing staff members that you cannot do without to protect their health?
Yep. And that's an expectation. That's all about being a public provider. Yep.
So this case that you have in Carterton is one of the cases that public health is looking at more closely because it can't immediately see a link with travel. So there is a suspicion, not yet confirmed either way, about community transmission. Are you prepared for the fact that your region may go up in alert level? Potentially?
Yeah, constantly. Yep. We every day we have at least an hour meeting about COVID-19 and what's going on, and we're prepared. We're well prepared if that's what happens. But the investigations with the Ministry of Health, and we're not aware of if that's the case just yet. But if it is, we'll step it up if we have to.
Prime Minister today asked people over the age of 70 and those with compromised immune systems to stay home as much as they can. In terms of the age level there, would that affect a significant chunk of people around your area?
Yeah. Well, firstly, I thought it was an outstanding speech this afternoon. It was exceptional. And yes, but we have a large elderly community, but gee, we're so well connected. I was just talking to a guy who's painting a mural outside the council building just a while ago, and he said they've already contacted every member in their street, but basically there's a handful of quite a large number of over 70-year-olds there, and they've already organised grocery rosters, all sorts of things. And Carterton's like that, you can't walk. You walk down the street and you say hello to someone, In fact, you wouldn't walk past someone without saying hello. So everyone knows everyone, everyone's trying to help one another. And when we're used to hard times, we've got a drought on at the moment, and our rural community is very resilient, and they're dealing with that as well.
Carterton Mayor Greg Lang.